I'm joined today with Dr. Chaudhury, professor at Simon Fraser University. Welcome, Dr. Chaudhury.
Thank you. Thanks for having me.
And your expertise is in an area that is so fascinating to me. It's around physical space and environment and health.
Physical space, or broadly, it's a physical environment and its impact on functioning, health, well-being.
And so just from the very start of things, share with us how important is the physical environment and space that you're living in for your health?
Mm-hmm. So physical environment is something we typically take for granted. It's right there behind the scene kind of a thing, but it has a critical role to play in our everyday interactions, social interactions, how we function in a space, how we interact with others, how we live, how we play, and so on, how we carry out our essential activities. So it has different scales. So physical environment at different scales. By that, I mean that home is one scale, intimate and private scale, but then again, we have housing and then outdoor spaces within the housing, and then we got neighborhood, and then we got city, and so on. So there are different scales that we can talk about, how they have different levels of influence in our functioning well-being. There's a beautiful and powerful way of thinking about this. It is called ecological aging, theory of aging. Ecological theory of aging talks about three things: behavior and affect as outcome. Behavior activity, what we can do in our daily lives, is equal to, if you think about this in an equation form, then that is behavior is an outcome of individual capacity and competence and interaction with the physical and social environment. So social environment is also important, but let's focus on physical for now. So what this theory is talking about is very important. It's saying that as people get older, as I mentioned, there are certain limitations in physiological capacity and perhaps cognitive capacity as well in some cases. Then we're not able to do certain things, and as we're interacting with the environment, so behavior goes down, behavioral outcome goes down. I need some help. I can't do as much as I used to, and so on, climbing up the stairs or running or whatever that might be, navigating complex environments. But here's the kicker, that this theory is telling us that we can change the environment. So if you think about the equation I just mentioned, B is equal to individual a person times environment. The person may not be able to change. Yes, some changes can be done, but of course that's limited. But the E can be changed, environment can be changed. So if we change the environment, we actually influence the outcome, which is the behavior. So in other words, the environment can enable or disable a person's capacity.
I think about environments like I was in Vietnam, and they had physical activity by design everywhere. And the older people were out at 5 a.m. in the parks doing Tai Chi or playing badminton or walking around, and they had these gyms in the parks. And I know we're limited by our climate in Canada, but how are we doing in terms of building environments to support healthy aging?
We have, from a policy perspective, there are many municipalities across Canada that have what we call age-friendly community action plans. So age-friendly community and cities is a program that was started by WHO years ago, and cities have adopted at some level of these plans, which include different items in terms like housing, employment, but also physical environment. So one of the items within that WHO framework for age-friendly communities and cities is like an 8-petal flower. If you look, there's a diagram there, and one of the petals is talking about outdoor environment and buildings. So what that is referring to the physical context of where we live, work, and play. So it could include the housing, but also the neighborhood. So many municipalities have these action plans. The challenge is that the physical environment is not always a priority. So they may be looking at housing in general, let's say affordable housing. That's, of course, very important. Accessible housing does get into resources as well to a certain point. So we are doing some progress. And the other piece is, of course, making our neighborhoods And you talked about Vietnam. That's something we also are looking at in Canadian context, how we can make the urban environment, rural environment, but the neighborhood environment more walkable, more amenity rich, and so on. So we're progressing slowly, very slowly. We need to really
Yeah.
ramp up things because otherwise we are, people are getting older. Canada is now almost a super age society, which means that
Hmm.
Canada, we have 19.6% people living with 65 or older, but according to UN, society becomes super age when they're 20% or more. So we are actually
Right.
up there. So
Right.
we
Right.
need to bring in more resources and more programs.
This suburb space to me is fascinating because I feel as though when you're in a city, you're almost creating small towns within that city. And so by design, your physical space, depending on where you choose, if you have the choice to live,
Mhm.
uh, can be have easy access to physical activity. By virtue of that, you're creating communities of social connectedness. Maybe perhaps not when you live in these larger condominiums and buildings, but when you look at the suburbs, they feel to me like a very unhealthy place to live by design in terms of everything is spread. So you can't really walk to the store in most areas. You have to drive everywhere. You're commuting, you're doing this. And so you might not even know who your neighbors really are. So the social connection is not quite there. Is there much about sort of the suburb space in the research? I'm kind of throwing you a wild card, but I'm
Yeah,
just very
so
interested in this topic.
there is some research. We have done also research from our team comparing suburbs with cities. And then there have been other research as well comparing suburbs and in terms of physical activity, social connection, mental health, isolation, and so on. And we have enough evidence to say that suburbs, as you just described, that suburbs are at risk for different reasons. One is, so if you look at physical activity level, in our studies, we have found that physical activity level for adults is less in suburban Metro Vancouver compared to central Vancouver. And we actually
Right.
compared US cities as well. So physical activity actually doesn't mean uh, necessarily, it includes what you call more formal physical activity, like going to a gym kind of a thing.
Right.
But more than that, it's about daily life, like the
Right.
day.
Exactly.
So can I walk to the bus stop? Is there a bus route nearby? And can I go and get it? Or can I walk to a grocery store? Can I walk to a pharmacy? So if my neighborhood is walkable, I will walk within. So we talk about, in our research and other research have found that the threshold for walkability for seniors is about like half a kilometer to 1 kilometer. 1 kilometer is
Okay.
the buffer
Yeah.
that we say for like a radial buffer, so to speak, from a person's household. That a person like a 10 to 15-minute walk, people are able to carry out
Hmm.
different amenities. So that amenity-rich environment is missing in the suburbs. So two things we
Hmm.
have mentioned from planning perspective. One is we don't have adequate amenities spread out in the suburbs. Quite often they are. You have to really take the car to go to a grocery store, right? It's
Hmm.
not 1 kilometer. But even if it's within 1 kilometer, the other thing is accessibility. So basically, that's referring to maybe there is a grocery store within half a kilometer, 1 kilometer, but I can't really walk because there's the sidewalk. I have to take my car.
Mm.
So it's not only the location. That is a problem of what we know as walk score. So you know that walk
Right.
score platform, which walk score does is it's actually a misnomer because walk score is basically talking about, although it says walk score, but it's basically giving a score based on not walkability, but actually on amenities in your neighborhood.
Okay. Okay.
So, well, that's great. That's first
Hmm.
step. But then again, I need to know, can I get to where I need to go to within that walk score situation? So that's what I'm
Yeah.
talking about. So these things,
Yeah.
so we have a big challenge, as you rightly point out, in suburbs that we need to do a lot of work in terms of densification. So meaning that we need to increase the density, housing density. And that would lead to the feasibility of what we call mixed use development. So mixed use development would mean that quite the zoning issues. So quite often the suburban zonings are mostly residential, except for certain locations where you can have shopping and retail. So we need
Right.
to break that down and have
Yeah.
more mixed use zoning, more higher density zoning. And interestingly, we have found in our research, and other people have also found the same, that when you have higher density, residential density, you not only make the retail more feasible to survive and to work
Right.
in different locations, but also that impacts what we call the pedestrian infrastructure and transit. So density has a direct connection, higher density has a direct connection with the possibility of pedestrian infrastructure. So it's a really interesting and important connection. And not all cities are the same. Vancouver is different than Calgary or Edmonton, and Toronto has its own character. But we all have suburbs. So
Yeah.
it's a matter of how much suburb do we have. If you look at Vancouver, for example, one last point, there's an interesting dichotomy or in situation that city of Vancouver proper does a pretty good job in pedestrian infrastructure. But if you go to some of the suburbs, they're very low
Yeah.
density, not naming names, but then it becomes difficult to get to places easily within walking distance. So even in Metro Vancouver, there's a wide variety of situations. Some are pretty good neighborhoods, some are not really good, and they need to be improved. The province of BC has mandated, which has there's some pushback, that all municipalities need to increase density and rezone all throughout all the municipalities. So that's maybe a blanket way of doing things, but the principle is a good one, that we need to
Right.
increase density, but we may have to look at it a bit more carefully by municipality where it makes more sense than the others.
Yes. Well, and we know as women hit this menopause stage and beyond, there's a risk for even further decline in physical activity. And
Mhm.
strength training is so important for muscle and bone health, but just movement. And so, you know, getting to the gym is great. You need to do that. But we also say, like, don't fool yourself to say, I went to the gym, tick the box, and you're sitting all day long. Like, you have to
Right,
just keep
right.
moving, 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 moving. So, for the individual, any words of advice or recommendations?
Because sometimes it's difficult to do things on your own. Like
Yes.
I may not want to do it on my own. So one option is to find a buddy, a friend, and we can do it together. One motivates the other. The other option to have a program like that, which I see a flyer. Okay, there's a walking club in the mall or in the park in good weather. Then
Yeah.
okay, I join that. So
Yeah.
there's an organizational or slash more like a community level initiative that's also critically important to make it. This is where the physical and social intersect nicely.
Intersect together. Yes.
Yeah.
I want to go back to the individual home space. But before I do, when you're talking about these social clubs that I think you see they exist a lot in the malls and these kinds of things, but the loneliness epidemic. I was in London, UK last year, and I saw these loneliness cafes and
Mhm.
advertising on the bus from the NIH about the impact of loneliness. And so, how impactful, how dire is that right now for the aging population?
It's pretty tired, pretty. Yeah. I mean, if you think about the numbers, it's about. So we know that about. If you look at the women in 65 plus, about 45% of women over 65 live alone. So many people are living in also remote areas and rural areas, as we know. So they are even more at risk of social isolation. So yes, so it is. I don't have the exact numbers on the social isolation per se, but there are, we know of course that there is an impact of social isolation on physical health, not only physical health but mental health, depression, and mortality as well. So this is something that is critically important, and actually not only remote rural areas, but it's also important for urban areas because, and going back to the suburbs too, suburbs are more
Right,
at risk.
right.
So
Yeah.
we need to do a multi-pronged approach to address this issue. the good thing is when you talk about physical activity, we're also talking about not just physical activity, but social activity and mental
Absolutely.
health. And then
Absolutely.
those are all related to physical social isolation. So one of the things that also needs to be pointed out is that we have a heterogeneous um, aging population in terms of ethnicity, in
Okay.
terms of physical activity preference, and so on. So what could work for one group may not work for other group. By group, I mean gender is one issue. Well,
Yeah.
for example, if you look at senior centers and community centers, more women are coming than men.
Right.
So,
Interesting.
so one of the interesting programs and successful programs that's growing in Canada is called Men's Shed. So Men's
Okay.
Shed is a really interesting program that started in Australia years ago, and now there's a Men's Shed Association in Canada where there are a number of Men's Shed groups, which is basically a group of men coming together, and at
I
one
thought you were
level.
going to say it's women to shed their men. Women coming together to shed their men. That's what I thought you were going to say.
So that's another way of looking at it.
That's a
I didn't
different
think
group
about it.
altogether. Sorry,
Yeah,
go on.
right. There may be a side effect of that of men's shed, that how women are benefited. Maybe not. I mean, anyway, let's not get into that right now. But so this men's shed is basically men coming together, a group of men, and so at a formal level, it's doing some projects, and these
Okay.
projects
Oh,
can be a charity project. They can do some projects for the local school or local community center. They build something, they create
right.
something, or they figure out something that they want to do on their own. But more importantly is the purpose, that I
Right.
have a group of
Right.
friends I can go to, and then that leads to the real interesting benefits. Is
Mm,
I'm not isolated. I can have a chat with somebody. I can have a coffee. So even if I'm not really into making things or doing things, I can interact socially and have a cup of coffee at the Manshed group, right? So
right.
this is
Right.
really interesting, and
Yes.
get
There is
perspectives
that
of it.
aspect of purpose and value that men
Yes.
feel like they need to maybe provide more than women in that context. Is interesting.
Exactly. So,
Mm-hmm.
that's the issue about understanding the heterogeneity in our aging
Mm-hmm.
population, older people population, that it comes with a different levels. So, one is gender, as we just talked about. Other is also age. When you talk about older people, well, we have to recognize people living in their 80s, 90s, and hundreds now. So, somebody who's in the 60s is quite different than somebody who's in the 80s and 90s. So, we need to think about the generational, even almost like a generational gap. A generation is typically 25 years, and you have a generation right there, a 60-year-old versus an 85-year-old. So
Right.
that leads to different lifestyle, different preferences, technology adoption, and so on, right? So that's so one activity that could be quite popular for people who are in the 60s may not be popular for who are in their 80s, and so
Yeah.
on. And also the ethnic diversity as well, right? So Canada is a multicultural country, and the different ethnic groups and language issues, life preference issues of what is a meaningful activity,
Right.
maybe for one group versus another group. So we have in the Vancouver context, we have senior centers in different ethnospecific communities. So we have a
Mm-hmm.
South Asian group with community where we have a senior center, we have assisted living, independent living. Same goes for the Chinese Canadian community, and then there are other communities as well. So the question becomes from that perspective is when we are trying to do something in a more unilateral way, neighborhood community house or neighborhood house, and we're trying to include everybody, we have to be sensitive as much as possible to address these different needs. And then it doesn't have to be addressed or cannot be addressed with one program per se. That's why programs like Mensheds are more
Mm-hmm.
important, and ethno minority groups doing their own programs, and they need to be supported. Right? So
Yeah.
it's one
Yeah.
thing to say it's important, but how are we supporting them through resources and other technical assistance?
Right. And so if we shift now to looking at like individual living dwellings, obviously when you have some physical functional issue and you need the physical space to be adapted, that is clear. I'm very interested in this sort of gray area where you're starting to age and you maybe don't have the same mobility. The either keeping it the way it is because it's forcing you to move and keep going, or adapting to accommodate the shift that's happening. So by that I mean, for example, a silly example is, leaving your toilet the way it is so that you really have to bend and get up, versus adding a seat lift to help you in that bend and lift. And sorting through that, like, where are you helping maybe a parent or something in their ability to stay at home, versus almost sort of progressing that decline by giving all of these adaptations in the home so that they're not using those muscles and mobility as much.
And some people may like to stay in age integrated community, right? So
Yeah,
people,
right.
even if they want to stay in age among their peers, they want to maintain their autonomy. So what we're talking about here is the need for innovative housing options.
Right.
So what do we mean by that? We're not talking about individual homes per se at this point. Of course, we can do home modifications, we can make them more accessible, we can improve home care and so on and so forth. But when you talk about innovative housing options, we're talking about innovative congregate housing options. So essentially, we have two middle ground between nursing home and home, which you just mentioned. One is independent living, and the other is assisted living. But not everybody wants to go there. So what we need to do is find other innovative models. So I'll mention one model quickly, which is the co-housing model.
Okay.
So co-housing is not cooperative housing. Co-housing is a model that started in Denmark in the 60s. And this is another term of co-housing would be, or another way of talking of co-housing is, it's an intentional lifestyle community. Basically, people want to go into a community setting where they want to interact with their neighbors and they want to be part of a community, rather than saying my privacy is really important, I don't want to interact with my neighbors. So it's an intentional choice that I want to know my neighbors, I want to do things with them, and I want to support them and be supported and so on. So it's a more model of interdependence and social interaction in a more intentional way. So Denmark started this in the 60s. It was brought to North America first by an architect in California. And then now it's actually growing in popularity in Canada. BC is actually leading in that way.
I was going to say it makes sense.
Yeah.
Yes.
Well, part of the reason for BC to lead is because as I mentioned about it started in California and it went north, Oregon and Washington, and exactly. And then we now have it. And I think the first one in BC was in the early 90s, 95 or 93. And now we have 8 or 10 co-housing communities. Wow. So co-housing, what is a co-housing? I mentioned the co-housing in general, but it's a community. It's not a rental. It's not a co-op. It's not for low income. It's for anybody. I mean, it's a market housing, and people will buy into a condo situation, but you belong to a co-housing community. And let me just describe quickly the physical setting. The physical setting will be beyond the apartment. Typically, it's an apartment. It can be row housing as well. But there needs to be, as far as part of design, there needs to be what we call a common house.
Okay.
So a common house would have a large kitchen, would have a large dining space, may have a child play area, can have a workspace, can have a guest apartment, and you name it, you can add to that. But these are the basics that have. Fundamentally, what we're talking about is that common house would provide the physical context for activities together.
Right.
Essentially, in co-housing, people typically have meals a few times a week together, and they take turns in. So there's no staff, there's no management. It's just resident run. So they have their own governance structure, and they have to figure out a way to. And this is nothing. I mean, I'm not talking about starting from scratch. There's good examples and guidelines.
Right.
You follow?
Yeah, yeah.
So,
Are there any other models that you're seeing that are emerging or that exist that seem supportive of,
yeah.
particularly I'm thinking of the dementia, Alzheimer's space. Maybe not,
So from the
yeah.
dementia side of things, yeah. So dementia is another big topic, obviously, that people living with dementia, when they're living in the community, when they need support in the dementia journey, that has additional burden for the caregiver. So
Mm-hmm.
what that means is that we know statistically, caregivers who are supporting somebody with dementia are providing 23 hours per week versus 17 hours of caregiving for somebody
Okay.
giving care to people who don't have dementia. So that what that means is that they are people with dementia at higher risk of relocation to a care home setting.
Mm-hmm.
Um, so when we talk about innovative housing options for people living with dementia, we haven't done a very good job. I mean, in terms of really community-based options. So
Mm-hmm.
like the co-housing is for again people who are cognitively alert and so
Right.
on, right? And there's also senior co-housing, which I didn't mention, but also senior specific co-housing. That's another option, or seniors only co-housing. But coming back to dementia, what we are seeing in terms of innovation is more in it's coming from the care side of things, long-term
Right.
care, but having more innovative community-based long-term care options. What
Mm-hmm.
do we mean by this? I'll mention two models. One is small care home. So small care home is a term that is being used for quite some time now, right, or called household model, small care home model. So if you go to any nursing home in Canada today, you'll find it feels like a hospital, like a semi-hospital. It looks like a very
Yeah.
institutional setting and long corridors. And at any given floor, there may be 40 people, 50 people living, 2 or 3 floors, and then big dining room and big activity
Yeah.
room and so on. So that's a very institutional setting,
Mm-hmm.
physical setting, but also it adopts a very biomedical model of care.
Right. Right.
Uh, and there are many good care homes that have implemented more what we call person-centered care of model or relational-centered care model, where they have moved away from the institutional model. Regardless, their physical setting is quite institutional, and that
Mm-hmm.
has an important impact. So to counter that, two models I'm mentioning, one is small care home, which would basically mean that instead of having 50 people on my floor, and a dining room for 50 people, I have a group size of 10 people or 12 people. So it's almost like imagine where you are living in your household, in your family. You may have a few family members. It's a large family, so to speak, like a
Right.
10 people, 8, 12 people maximum. So 8 to 12 is the range we talk about when we say small care home. And they have their own small dining, small activity living space. So what that does is that when we talk about dementia, one of the important things about stimulation is a challenge. So it's
Okay.
from the physical environmental stimulation, like lighting, noise, the scale of the space, how big the dining room is, and so on, and also social stimulation. So, how many people, as a person with dementia, how many people do I see in my dining room, in my activity room? That will
Okay.
impact my comfort level and well-being level,
Okay.
right? So I would get more agitated, likely, or anxious when I see a lot of people, and then I don't understand what's going on. I can interact
Right.
with them, as well as the physical stimulation, right? So when you create like a small care home, you're
Yeah.
creating basically a kitchen, basically a small living area, which looks like home. A, B, the 6 or 7 other people,
Right.
and maybe 1 or 2 staff. So
Mm-hmm.
that this model has been around for quite some time. It started in Scandinavia, mostly in Sweden and Norway, and then in the US, they have had from the 2000 onwards. There's a model called Greenhouse Project. So
Okay.
Greenhouse Project is not the greenhouse we typically think about. It's not some sort of sustainability. Yes, there's some part of that, but its greenhouse model is basically talking about small care homes, and they have many, quite a few in the US. We don't have that particular brand in Canada, but we do have quite a few small care homes here in Canada as well, in all the provinces. We have in BC, we have in Ontario, Saskatchewan, and so on. These are so. What I'm talking about is, when we talk about care home or long-term care home, typically from the economy of scale perspective, you need certain number to make it function, and that typically is
Right.
100 plus. But when we talk about small care home, it doesn't mean that small care home is living in isolation. What I'm referring to is that it could be like a one-story, multiple small cottages, or it could be like a high-rise, not
Right.
high, like a mid-rise,
Big building.
but
Yeah.
with like two or four or three households or small care homes at each floor. So once you're
Mm-hmm.
in the unit as a resident, you are part of a small care
Right.
family, small care home.
Right. Right.
So that's one. The other model I'll quickly mention is what we call dementia village.
Okay.
So which started in the Netherlands in 2009. What it is it's saying that when people move into, especially people with dementia, move into a nursing home, they are isolated from the community, right? They can't go out on their own because they are at risk of safety. They will get lost and so on. They can go out only if you are taken out by family or staff and so on. And
Right.
within the community itself, the nursing home itself, care home, there isn't much option of other things to do. So one could go to the activity space or dining space, and if the person is lucky, there may be a garden space. So to counter that, Dementia Village is a concept that creates a community, a small community, which would have small houses, and that will have easy access to our doors. So the doors will not be locked, which is quite often locked in the regular care home. So in a dementia village, the door will not be locked. If I'm living as a resident in a village, I should be able to get out on my own, but in a secured space, meaning there's outdoor spaces where I can
Right.
walk around without fear of getting lost, and so on, right?
Yeah.
So
Yeah.
and then not only that, it's also mimicking to a certain extent what we might expect in a regular community, meaning in a dementia village, there would be a grocery store, there would be a salon, there would be a cafe, there would be a restaurant, there could be a theater, and so on. So the point being that it's creating a community in that context where people can still go to places they have gone to for decades and be familiar and be part of things, activities. So that started in the Netherlands, and I'm pleased to
Yeah.
say that there are only two dementia villages in North America, and both of them are in Canada, and both of them are also in BC. So, which is great, and
Oh, you BC people, you're just driving the train.
you should come and visit us sometime. Yes,
I would
absolutely.
love to. I would love to.
Right.
It's so beautiful out there.
So that's a new model that we are also promoting, and
Yeah.
that has a lot of promise.
Fantastic. That's exciting. One last question. If there is one misconception around physical space and the importance of it in aging that you would love to erase, what would that be?
Small things matter. So
Mm.
we don't have to. We talked about the importance of the physical environment, but just to drill it down a bit further, that we don't have to create big things. Of course, creating a dementia village is very good, or home modifications are good. But when we talk about even for coming back to a person's home, and you raise that quite a bit, and that's an important piece. Most seniors live in their own homes, not in a care home. Small things can be done in your own home. So, which can include, for example, color contrast. So, color contrast is something we don't do very well in terms of design. So, color
Yeah.
contrast means that people with vision loss and also perception loss, depth perception loss, contrast in the objects around you would be important. So I see, I am seeing in your background, I noticed the cupboards, right? I don't know if it's a real or not, but it looks like
It's
is
real.
that it's real, right? So we can say that how do you design the handle of your cupboard, and so that can make a difference in terms of how people can
Right.
grab things. And then is there a contrast between my handle and my cupboard? Also, we talk about, let's say, bathroom, we talked about toilet. A simple thing that we can do is, toilets are typically all white, right?
Right. Yeah.
Of course, floors are white and walls are white, but even just the toilet itself, I can change that. I can replace the white toilet seat with a black toilet seat, which used to be in the old-fashioned way. It used to have black toilet seats. So anyway, what that does is it creates contrast for people with sensory losses, with vision loss, or to find the toilet easily. We can bring in some how would you say this in the kitchen as well, labeling things where things are. So talk about dementia, we would design slightly differently. We would have clear cabinets, so the glass cabinets, so I can see things where things are. So if I don't have that, then one simple thing we could do is label them where things
Right.
are. So that's one way of helping people where things are. Lighting can be improved without a lot of cost. So lighting is important, but not
Right.
not a whole lot. So it's appropriate strategic lighting. So color contrast, changing proper, bringing in proper stimulation, environmental cues, memory cues. These things can really make an important difference. Also, people with dementia context, clutter. So people need some easy access to things. So removing clutters and making
Yeah.
movement easier could go a long way. So small things. This goes back to actually the theory that I mentioned. We not only talked about the importance of the environment as we get older with the sensory losses, and also chronic conditions, but also the fact that small things can make a difference.
I love that so much.
Yeah.
I think sometimes we get stuck in inaction because we think it has to be big. But if we just get started with small things, it can make a difference.
And being
100%.
creative about that. Yeah.
Mm-hmm. Mm-hmm.
Yep.
Well, Habib, thank you so much for your time. And I'm so grateful that you're dedicated your career to adding to the knowledge that we have in this space. So thank you so much.
Happy to. Lovely speaking with you, and thank you for the opportunity.